Hello, I am Yuslaina Tacoma Las Luisa. Today I'm going to talk about coronary artery occlusion from Kawasaki's disease. Definition: Kawasaki's disease is an acute febrile multisystemic vasculitis, more prevalent in children. It is an idiopathic and symptom-limited condition. Currently, it is said that the coronavirus could trigger Kawasaki disease. The clinical manifestations are persistent fever, bilateral conjunctivitis, non-purulent, oral mucositis, cervical lymphadenopathy, polymorphous rash, and changes in the hands and feet. The fever and acute inflammation that lasts an average of 12 days without treatment. But Kawasaki disease may cause cardiovascular complications like coronary artery aneurysms and can lead to coronary occlusion and cardiac ischemia.
Cause serious heart problems. The New York City Health Department recently reported that children ages 2 to 15 displaying Kawasaki-like symptoms were also positive for COVID-19. This raises the possibility that the coronavirus may be a trigger for Kawasaki disease. See a doctor if your child has a fever for more than 3 days or has a fever and 4 or more of these symptoms: redness in both eyes, a very red swollen tongue, redness of the palms or soles, skin peeling, a rash, swollen lymph nodes. Getting treatment within 10 days of when the disease began is key to reducing any long-term damage.
Applications in medicine. Characteristic signs and symptoms are recognized in a physical examination, while an electrocardiogram is the ideal test to diagnose complications such as myocarditis. Treatment avoids systemic inflammation and prevents thrombosis in developed aneurysms. This is based on the administering intravenous immunoglobulin, and if there are complications, corticosteroids are used. Pros and cons. Pros: if the treatment is used, it reduces damage to the coronary arteries by 2 and 4%. Echocardiography makes it easier to recognize the alteration to diagnose Kawasaki disease, which allows a timely intervention with a specific medication. Cons: without immunoglobulin intravenous treatment, 15 to 25% of patients develop coronary aneurysms. Poor treatment can cause thrombosis and myocardial infarction. Kawasaki disease can be underdiagnosed or not treated in a timely manner.
This syndrome has many of the characteristics of a condition called Kawasaki disease. And we've seen this in young children for decades. Kawasaki disease is an inflammatory condition. And at Texas Children's Hospital every year, we see more than 100 children with this condition. And so we really have a lot of experience in dealing with it. One of the reasons why Kawasaki disease is of interest to cardiologists is that an important consequence of the condition is that you can get inflammation in the heart itself, and importantly, inflammation in the coronary arteries. These are the small arteries that supply the heart muscle. And so if these arteries are inflamed, then it can really place the heart muscle at risk. So as a result of this large experience, Texas Children's Hospital has gathered a lot of multidisciplinary expertise around the care of children with Kawasaki disease. This expertise comes from cardiologists, experts in inflammatory diseases such as rheumatologists and immunologists. And we believe that this expertise, combined with our vast experience in critical care, patient isolation, infectious diseases, will serve us well if we're required to run towards this new COVID-associated problem. We are ready for it.
Issues applied in Ecuador. According to the Ecuadorian Ministry of Public Health, Kawasaki disease is defined as a rare disease with a prevalence of less than 1 per 10,000 people. Conclusion: cardiologists of children and adults should consider a history of Kawasaki disease in the different diagnoses of valvular lesions, cardiomyopathy, and coronary-artery disease in adolescents and young adults, especially those without traditional risk factors.
With Diane Larson and Lee Conklin.
It's a disease that is extremely rare. Several kids who've survived it live in the Bryan, Ohio area.
And the reason for that has baffled doctors there. And parents want others to know the symptoms to watch for to keep their kids safe. Our Melissa Vage has the story, all new at 6.
Lee and Diane, this is a potentially fatal condition, and it normally affects children in Japan. But we have an unusually high number of kids with it in the Bryan area.
They did an episode on Grey's Anatomy.
When Jennifer Grant's son Owen was just 3 months old, he spiked a high fever for days on end. At first, doctors diagnosed it as a virus, but it got worse.
They did a lot of x-rays thinking maybe there was something wrong with his stomach.
Jennifer says his symptoms continued to worsen.
It was a parent's living nightmare, just watching him continually get worse and worse, and there's nothing I could do but watch him deteriorate.
6 days into this, doctors discovered Owen had Kawasaki disease, a rare virus that causes inflammation throughout the body.
Light bulb, like, yes, he had the red lips, the red eyes, the fever that wouldn't go away, the rash on the body.
Kawasaki disease is more common in Japan, but it does affect kids up to the age of 5 here in the United States. However, it is still quite rare, except in the Bryan area, where there are at least 5 children who survived it.
If it goes unrecognized and untreated, it can be a fatal disease in children.
ProMedica pediatric cardiologist Dr. Jeffrey Moore says that can and does happen because the symptoms mimic a common virus, except
It has involvement usually of the eyes and the tongue, which you don't tend to see in most viral illnesses.
treatment with immunoglobulin therapy reduces the swelling throughout the body, but the heart is at greatest risk.
It can develop coronary artery inflammation, and that inflammation can lead to abnormalities with the coronary artery, essentially that can cause a heart attack in very, very young kids.
5-year-old Andy has permanent heart damage from Kawasaki disease when she was just 4 months old. Her mother, Carrie, says she has aneurysms where the walls of the coronary arteries have weakened and have potential blood clots.
She has aspirin every day. She gets 2 injections of blood thinners every day, and she's just very closely monitored.
While families don't expect to ever know the reason for the disease concentration in the Bryan area, doctors are curious.
I would say that is pretty rare. I couldn't give you a good explanation of why, unless, like I said, it was a certain viral illness that just happened to be sweeping through Bryan that was kind of the trigger for a number of kids to develop Kawasaki disease. But it is rare.
In Bryan, Melissa Vage, 13 ABC Action News.
And now to a 13 ABC.
Thank